we're greeting you from Quito, Ecuador, the middle of the world, and we are here in Alquimia Podcast, connecting you through knowledge. Today we have Juan here, and he is going to talk to you about Chinese medicine.
Hello, Maria Jose. Thank you. Thank you for having me here.
No worries. Thank you for coming.
I'm super happy to Chinese medicine. Chinese medicine is my passion, so I'm super grateful to be here and share this beautiful subject with you.
That's amazing. Can you give me a quick introduction of who you are professionally? What's your main focus? And what's your approach to health from Chinese medicine?
Yes, a little bit of my story is that I'm a medical doctor. I graduated from San Francisco to Universidad San Francisco here in Quito. And it was super interesting because early in my studies, I was trying to understand medicine in a functional way, how the body behaves, how the body reacts, and how the body functions. But with conventional medicine structure, what I saw, it was that they go straight forward to disease.
Okay.
So that was like one of the contexts that helped me to a little bit research in another areas of medicine. And it was a time in Universidad San Francisco, a professor of mine, Fernando Ortega, who shared with me a lot of knowledge about, they used to call alternative medicine, but it's not, I like to call it like non-conventional medicine, like medicine from the Andes. And there was a class with Chinese medicine that really hooked me because he explained us like concepts that we are not used to think or understand. And it was a mind-blowing thing for me. And after that, I went to the States. I did the USMLE, the exams, preparations, in order to become a urologist, because my dad is a urologist.
That's interesting. Coming from a medical doctor family to have Chinese medicine in your profession right now and do what you do, it must have been interesting.
Very interesting, yes. The whole timing, it was like super, super interesting. In the States, when I was doing the exams, actually I was hooked by yoga, because it was a stressful period of like studying a lot. And I started to do a lot of yoga in order to like harmonize, calm myself, in order to do the exams. So that with the Chinese medicine knowledge that I had in the university and with the medical context too, the conventional medical context too, that opened my mind a little bit more. You know, and after that I did the exams. I passed the exams in the United States. And immediately I came to do the rural medicine in Yasuni, in the rainforest here. And that year was very tough, but it was very eye-opening too. And I was alone, like in charge of a healthcare center, with anything that I could use in order to help people, because you don't have practically like anything there. And that year was very, very, very tough for me, but that opened my mind a lot. Actually, I was doing a lot of yoga then when I was there, and yoga was like one of the things that hooked me, Ashtanga yoga, like a lot. And maintain my health, especially in those like times that are like very, very, very tough, you know? Survival, I call them like survival times.
Yeah. And
after that, after doing the rural medicine, I was an internal, a residency. I did a residency in Solca. That is a hospital here in Ecuador. That is, their main focus is a specialization or specialty in cancer.
Yeah,
you know, so
for cancer patients.
Cancer patients, yeah. And that really was like another eye-opening period for me, because I actually could see and palpate how the function is depleted in those patients, you know? So I was like, there must be something else that we can do in order to activate that function. And that's Chinese medicine. So the yoga, the Chinese medicine was always in my mind. And in that time, it was perfect, because that time was, I decided like, no, I have to go through a different approach with this. And I researched like programs in the United States. At the beginning, they accepted me in one program with American College of Traditional Chinese Medicine in San Francisco, and I went there. I spent like 1 year there, and after that, I moved to Chicago to another school called like Pacific College of Oriental Medicine, and that school was very, very interesting, because it was a classical, canonical school. What they did, it was you go to the canonical books, to the classical books like the Huan Din I Ching, the Shanghenlun, in order to understand and grasp the whole theory from the root in Chinese medicine. The studies was like very profound, very deep, in order to understand what Chinese medicine really is. And it was another eye-opening period for me. And I met a lot of people there, a lot of people who knew. It was a 5-year program, and it was a master's of 5 years. So actually I did a clinic there 1 year. I studied there and I worked there for 1 year. It seemed like very interesting cases. And then I went back to Ecuador. After that, I came back to Ecuador and I started my here in my country
your practice.
My practice, yeah.
That's amazing. So you're crazy prepared. You've been through a lot in studying. And what I think the most interesting part of this is that it comes from your need to fill the gap from the traditional medicine that we have right now. So it has a gap that you were trying to fill somehow, and ancient medicine, Chinese medicine, gave you an approach to this that traditional medicine nowadays doesn't have.
Exactly.
That's amazing.
Yes, and actually that's what I do with every patient that I receive. It's very interesting because I try to change that dialect or that language on how they see the world, and when they make that change in their chip, I call it like chip, they understand how in Chinese medicine we see the world and how the treatment is going to be. So the dialect, the language is changed, and actually that's more important than even the needle technique. It's super interesting when you change the mind of the patient, and the patient is hooked about these concepts, and the patient understands what we are trying to do. There's good results.
So it's more
super interesting.
Change of perspective on how we see the body, how it works, and the different systems that we have. That's
exactly
super interesting. So now can you tell me more about Alquimia? Like, what's your role in Alquimia Health? What does Alquimia do, and what do you do there?
Yes, so Alquimia is a project that we have with with our colleagues. We have Alberto León there, that is an internal medicine doctor. We have a nutritionist that is Alegría Valdez, is functional nutrition. And I'm there with Chinese medicine. We have you with yoga, that we're going to talk about that later on. And we had Cecilia, that is our manager, our colleague, that she's very focused into conservation. It's super interesting because in Chinese medicine, the environment is super important. So that approach is very interesting, and we're going to explain later on also how we are trying to connect this conservation part of the world with the human, with the patient. Is super interested that in Chinese medicine. Actually, that's the Huan Din I Ching approach, one of the classics. The world is the patient, or the environment is the patient. So yeah, so we have a lot of a team with different approaches. So Alchemy is is trying to mix those different kinds of approaches of functional medicine in order to help the patient. That's the thing. With those different approaches, we can apply them in each situation, in each patient, even with yoga, with you,
Yeah, and different aspects of the life of the patient. Because it's not only treating the symptoms, but maybe getting a better lifestyle, better habits in order to prevent disease and just to have an overall more balanced life.
Exactly. And again, the environment is super important. We're in the middle of the world. We have an environment, microclimates here that really help for me in Chinese medicine to treat the patient. For example, actually finding a Mindo type of climate is super interesting because it's kind of like a neutral. You need that warm, you need that foggy.
It's humid, it's a valley, it's kind of warm, but it's not that warm. It's actually really, really pleasant.
It's pleasant. So that's the perfect environment to treat a system.
Oh, that's amazing. We're blessed.
Yes.
We're blessed to have Alquimia here in Ecuador.
Yes. It's a beautiful project. Actually, I'm really, really excited about this.
What type of health does Alquimia works towards to? like which type of health, not approach, but which type of health do you want to build in Alquimia with the team?
Yes, actually, like one of the things that we have been the concept that we have been unifying as a team is that we have to do a medicine that is transformative, you know. And actually, in Chinese medicine, there's this concept of wrong that is kind of like the life purpose, you know. It's like that flower that is in the middle of the jungle that lives, but it breathes very well, you know. In spring it goes out, it expands, in autumn it contracts, you know, and express that beauty, but expresses that beauty by itself. Okay. You know? So that's what we want to do with every individual, you know, like trying to work, in my case, to work the system in the biothermic way, in a circulatory way, like the system is an ecosystem of every patient, to enhance that circulation, to harmonize that circulation. That's what we do with acupuncture. And in order for that patient to become function, in order to express itself in life.
Yeah.
So transformation is the main thing. You know?
I think it's very interesting how you said this thing about the flower, because you know the flower, it doesn't stay blooming forever. It has times that it has to rest. There is times in which it blooms beautifully, but it's also like us, right? You cannot expect also an individual to be always blooming. We need times of rest, we need times of digesting, and we need times of blooming and flowering. So I think that's a beautiful approach to see a working system with the human body reflected in nature, because that's kind of like what we want to do, right?
Actually, that's Neijing or Han medicine that we call it. That is the Neijing medicine, is that respecting timing, you know. It's like Chinese medicine is very temporary. Time is one of the most important thing. Like patterns in time is like more important. The wuxing, that is the 5 phases, the 5 movements, is you have the 4 seasons, and you have a late season that is the late summer, and that's a movement. And if you respect that breathing, you're gonna have health, and that's the main thing.
Harmony. That's amazing.
Harmony.
Can you tell me more about the Alquimia Retreats that we're planning on offering soon? What defines a medical retreat?
Yeah, for us, when we were like trying to do this, when this idea came up with the whole team, the main thing was like, we are doctors and we want to do medical retreats, you know. And so Alberto, for example, that is the internal medicine doctor, he's gonna bring patients and he's gonna evaluate, he's gonna do exams, and he's gonna do the mainstream conventional medicine that is really valid for us, for the patient, you know. And then we are gonna like do the therapy in terms of what we find in each individual, you know. And one of the things that really separates us from the rest of the retreats that is very unique is that is a medical retreat. And in Chinese medicine, you do internal medicine. You don't only like treat pain, you do internal medicine. In China, you do internal medicine. If you go to a hospital in China, they do internal medicine with Chinese medicine and with conventional medicine. So we need to start to do that. And the idea was amazing, because what a beautiful place that we have here, what a beautiful climate that we have here. They are going to be in Mindo, that we can like put an approach of like complementing the environment, the Western medicine approach, the biomedicine approach, the Chinese medicine, the nutrition that is so important with Ale, and the practices of cultivation like yoga, even Qigong, Tai Chi, and it's that whole approach, because everything is valid, is gonna make a perfect difference in the patient, in the system. That's gonna be transformation, and I'm really like excited, but super. I believe in this. Yeah. I believe in this approach, and that's the gap that you were talking about. The gap that I was like trying to find in some of the medicines, that Chinese medicine was the perfect one for me, was to do that, to complement all of those and do it in a really nice place and with people that are really passionate about it, and with people that know about every aspect of each field that they manage, you know.
That's
biomedicine and including you with yoga, Chinese medicine, nutrition with Alegría, and even the project that Cecilia, our manager, has with conservation, for me is like mind-blowing, because it really relates with the Juan Din I Ching, what we were talking about.
So it's like a lot of pieces of the puzzle are coming together, right? We have let's say the safety net, in which a patient comes with a regular medicine evaluation with Alberto, and then you have another therapeutic approach with you on Chinese medicine, and it also gets super complemented with nutritional advice from Alegría, and we have practices to help people cultivate better habits and also regulate their nervous system while they are there. So it all comes together in a beautiful mix of just balance, I would say so. And why are these retreats not considered wellness retreats? Why, like, is it because we have medical doctors that are trained in the field, and it's not just like a come here, meditate, and leave refreshed and happy? We want to change their lives. So can you explain a little bit about that?
Yeah, that's one of the points that I really reinforce. That's one of my important points, because as I told you before, Chinese medicine could be, you have the spa type wellness type of Chinese medicine that we are like used to have it like here in the Western side of the world. That is really good. It really calms. It really helps. And actually, like, sometimes you need that more than other things, you know, really calm the patient and wellness. But when I studied Chinese medicine as a doctor, as a Western physician, I wanted to find out like how they treated disease.
Yeah.
Because in the Juan Din I Ching, they treated disease like 2,000 years ago. Malaria. They treated malaria. They treated like you have the Bing, that is the character of disease in the classical texts, you know? And that's what really hooked me. So, as a Western medicine doctor, as a Chinese medicine doctor, especially a canonical Chinese medicine doctor, medicine, internal medicine is my forte, is my way to go the rest of my life. So, having this type of approach was perfect for me. We're gonna include like wellness approach also, because it's really valid. Yeah. But for me in Chinese medicine, my approach is actually get it into that point as they do in China. They treat disease. So that's my main focus. And we're gonna have the rest of my colleagues here, and they're gonna explain their way of view of things. But that's my way of view, and actually I think that's very unique, and it's gonna create I think in my mind I'm always thinking, but this is revolution, you know.
Yeah, I think that's so true. Can you walk us through what happens during a medical retreat for the patient? Let's not get into like the details of the itinerary, but first they come and they get evaluated, or do you get an evaluation done at home, then the treatment, then the follow-up? How does it work? How does the treatment work throughout the days?
So there's going to be a preparation for each patient. The patient that is interested in going and coming here, Alberto is going to be the first step. He's going to do exams. He's going to have a consultation, a private consultation online. And he's going to know the patient. He's going to evaluate. He's going to send some exams. Actually, the exams are going to they're going to be done here in Quito when people are going to arrive. We have a really good team of a laboratory, of imaging, that are going to help us. And we're going to have an idea of the patient and the cases that we're going to receive. So we're going to standardize, we're going to individualize that approach in each patient, you know. Actually, that's Chinese medicine. It's not a standardization, it's individualization according to where the body is in the moment. It's super interesting. I'm going to talk about that later on. But having the idea of what the case is, what are we going to try to treat, it's going to be very interesting. So there's a preparation, there's consultation before, there's exams before, and we're going to be prepared in order to, when people arrive, in order to start the therapy. And for me, for example, I'm going to try to do treatments in the patients that they are open to Chinese medicine, because that's another thing. There's going to be patients that are going to say, no, I'm not open, I don't like Chinese medicine, and we're going to respect that. But we're going to explain why in some cases is necessary to have that approach.
Why we recommend it, why we believe in it, and what's the purpose of it.
Exactly.
And how does the follow-up or the support, the ongoing support work? Like, do they leave the retreat and then that's it? Or do they have a couple of more control consultations afterwards?
Yes. So we're going to try to treat the patient like in the moment. Like we have the preparation, then we're going to have like the treatment per se during that 8-week period. We're going to also, after the treatment, we're going to do some presentations and some conferences about ideas that are really super important to grasp. That's how we're going to do give knowledge of people of not only like you've been treated and you're okay, like tips of how to live your rest of your life. For example, for me in Chinese medicine, according to constitution or your confirmation that you are at. So for example, you need to drink or eat cooked and warm food the rest of your life because you have a cold in the stomach or the spleen, we call it. Those concepts, they are going to be understood by the patient, and that's transformative, and that's information that we're going to give during the treatment. And also we're going to have follow-ups, So after the treatment, we're going to have follow-ups that are going to be online, but just to see how transformative was all the whole therapy,
The whole experience.
Experience, because that's our main goal. And for example, with internal cultivation, with yoga, with qigong, with Neigong, I'm gonna go give tips in order to be for the patient to practice that for the rest of the life. It's gonna be very educational in that way, in order to that practice to be supportive for the rest of that life after the treatment.
Building a healthy lifestyle.
Exactly.
And so it's very interesting, and I think it gives a lot of peace of mind to the patients that will be coming to this, to have a medical team always present there, so they will feel safe and supported throughout the process. They are going to be 7 days long, as I think, right?
7 to 8 days.
7 to 8 days long, perfect. And individual diagnosis, a personalized treatment for each, because as you were saying, we have to respect each body differently because we're different ecosystems, so we cannot be treated the same way, as well as the educational part, which complements everything beautifully, since it's not like taking a pill for your symptoms. We're actually learning what we're doing to our bodies, and that way we can transform, as you said before, our conception of health, of our body and how it works.
Perfect. Yes.
So yeah, it's a complete approach to like every part of our body. And what do you what is your role during the retreats, besides it's just like the acupuncture? What is it that you do when you're directly supporting a patient?
Yes. So the main goal is to treat the patient or the system in the circulatory way. Okay. There's a concept that is like the qi hua, or the qi transformation of shui, of blood, that is, I call it like the quantity, quality, circulation, transformation, oxygenation of the blood. That's the whole concept, and that's the Jing Mai, Jing Luo, that is like the channels, the rivers that we call it. So with acupuncture, we treat the system. My professor said that, like Edward Neal always says, like, you are an agriculturist and you are treating an ecosystem. You're opening the rivers, in order to that ecosystem to flourish. And that's what we do. The approach, the conventional approach, is always put something to do something. But none of the medicines, or a small quantity of the medicine approaches, are like how my blood is going, how my river is going. But in terms of that context of quantity, quality, transformation, and oxygenation of blood. And we can see that in systems. For example, cold hands and feet is a sign, a typical sign, or night sweats is a typical sign, a cardinal sign that says that there's not enough of that qi, or it's too much of that qi.
Okay.
And so for me, in Chinese medicine, I'm going to see how the ecosystem is, and I'm going to enhance the circulation of that ecosystem. And that's what we do in aging medicine. And actually, like the Wu Lun Qi, the climatic factors are super important. So if you are in the middle of the world in a beautiful climate, that's going to help to reestablish the circulation in the body. And that's what we do in Chinese medicine.
That's amazing.
Mm-hmm.
Who would you say this retreat is directed to? Who would you recommend it to?
There's a concept that I call, it's a concept that you have in the classicals actually. It's called the Shulao. The Shulao disease is the consumption, the consumptive disease.
Okay.
You know, and we're gonna talk a little bit of Chinese medicine theory a little bit on, but patients that are like systems that are cold, systems that they don't react to a therapy, systems that are like depleted, systems that are like that that you do everything in order to reestablish something and you can. They give you something in order to, especially in oncology or chronic pain or long COVID, those systems that are mystery, that nothing helps. Chinese medicine is where it's at with those systems. And that's the approach. And we're going to talk a little bit more about that later on. But those are the cases that I like. When Western medicine can't find a way to help, and they do everything, that's where we enter, you know?
Is there any specific age group that you would say this is recommended to, or is it open to any kind of fitness level, age, and activity level?
Exactly, activity level. You can have consumption, for example, in athletes. You know, athletes like elite athletes that are like always consuming because they are overtraining. Those are patients that are like, for me, super important to reach at, because you in Chinese medicine, you can know where to stop. You can know in order to not consume itself, in order even in to enhance that performance. It's super interesting, you know, and also in chronic illness, like I said, but there's no age. I mean, you can have consumption like early on. Like the other day, I received a patient that is paddle. It has 35 years old, and he's already having degeneration of the joints.
Wow.
That's cold inside. There is no timing for that. But the super or the over exertion of the sport is and the whole system was very, very cold, is producing this. So that's the way, and the Chinese understand this very well, and that's where we enter to, you know.
So it's directed to pretty much everyone in every age group. That's amazing.
Yeah.
And yeah, but good luck trying to make an elite athlete rest for a week. You know, I think sometimes we live in this world in which we have to be productive, and we have to be disciplined, and we have to accomplish something, in which having the time to rest and do something and observe our bodies and how it behaves and what it actually needs to, I don't know, build up more energy or feel more rested or more in balance, it's actually difficult.
Is the timing of rest and digest.
Yeah, we
need
that.
Alquimia Retreats is time for that.
So important nowadays. And I think we can move on for you. We can move on, and I'll ask you a couple of questions about Chinese medicine. How did that sound?
Yes.
All right. So according to Chinese medicine, how do you evaluate the correct functioning of the body or of a system, as you were saying?
Yes. There's this concept of leakage. It's called contraflux, we can say it in English. Leakage, or for example, I always ask, first thing that I ask is, like, as I said before, like, if you have night sweats, that's something or a spontaneous sweat. Sweating is a cardinal sign of seeing that there's leakage in the body.
Okay.
You know, there's a sign that in biomedicine they take it as an important sign, but for us it's cardinal. That's an alarm sign, like night sweats, spontaneous sweats, because that's leakage. And a patient that have like that sweating, that hyperhidrosis all the time, is leaking. That's function, that's heat from the inside that you are like it's called false heat, because it doesn't have to go like up and out. It has to go down and in order to maintain that warmth inside, to those vital organs warmth. That's function. So leakage is a concept that I always talk about. So it could be night sweats, it could be a cough, it could be a leakage, or a reflux, or uterine bleeding. Those bleedings, you lose blood, but you lose the material part that is the warmth from the inside.
So a leakage could be seen like we have an open faucet and it's
Exactly.
always dripping, 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 and it's not a lot, so we don't call the plumber to come and fix it. But it's actually an issue because we're losing
You're losing.
our, I don't know, energy. We're losing.
Yes, you're using your physiology, your function. And what happens with time, it's called false heat because it's false. But what happens with time is that you get true cold. We call it true cold. That is like that internal organs that are like fatigued. You know, they don't work in 100% matter. They work as a 75% matter. And when that happens, especially with the liver, you're gonna have a lot of things. The liver is one of the organs that the liver and the spleen, well, all of them, but the liver is one of the cardinal organs, the minister that actually controls this, manages this. So it's super important to go and find leakage to stop that in order to have function.
Can you tell us signs of leakage on our sleep, for example?
Yes. For example, night sweats. That sleeping patterns that are like not deep, not profound. When you remember dreams, actually in one of the syndromes that we studied is like the sexual dreams in women, or the wet dreams is like a big leakage. It's super interesting because that's the physiology that you use to procreate, and the vitality is there. That's a Taoist concept, but you need to use that energy in order to procreate, not to satisfy.
Yeah.
And when you leakage, you're like depleting the functioning of especially the kidney, So it's super important for us to find those leakage, even with those subjects, like in sleeping patterns and night sweats is super important. When you wake up like 1 to 3 a.m., like you just open your eyes, that's the liver time, and you can see that you're having a leakage. Sometimes like those nightmares that you wake up with palpitations, like with that horror nightmare that you had, like that's a leakage. Like for example, in recess in children, when they wet bedding.
Oh, okay.
Yeah, that's a leakage that tells us that there's a confirmation or a constitution of like weak kidney,
And would waking up to go to the bathroom be considered a leakage during sleep, or is that a different system?
Yes,
Okay.
that's a leakage. For example, like an irritable bladder.
Oh, yeah,
That
okay.
you wake up like just to urinate all the time and you can't sleep because that's a leakage.
How about the digestive system?
The digestive system I like to call like the irritable bowel syndrome, especially those inclined to diarrheas.
Okay.
That's leakage, and people live with that.
Yeah, because
Yeah.
we've normalized not
Exactly.
feeling okay.
Exactly.
What about sexual health with the leakages?
Yes, the sexual health, as I mentioned before, the dreaming is super important just to notice if there's leakage. For example, like sexual desire, when there's too much, that's called fire. That's yin deficiency, we call it. That's for dryness. It's super interesting, but you get like a lot of heat because of dryness. And those are like the majority of people that are like in older ages that are like very dry, and the sexual desire like tends to like go up and out all the time. But also that's too much. But there's also this concept of not enough, that you don't have libido or you don't have sexual desire. That's cold in the inside. So one is like false heat, the other one is true cold. So that tells us also like the health. The thing is that we have to find the sweet spot, the spot in between.
Yeah. What about pain?
Pain is super interesting because with pain is a stress, and when you have pain, for example, I'm gonna give this example like fibromyalgia. Those type of pain are like chronic. It's an inflammation of the fibers of the muscles or the nerves, but that's an irritation, that's an irritability, and that can be a false heat, but it can be a true cold. So for example, people that like have like blood deficiency, like anemias and all of that, and you have fibromyalgia, is there's a blood related connection there between that. And so for us it's super important to identify that, because when you lose a lot of heat or physiology, you're gonna deplete yourself, you're gonna get cold. And chronic pain, not the majority of times, but sometimes, is related with this type of contraction, cold. It's the shanghang, is the cold in the inside. It's the damage of cold. They call it like true cold because shanghang is damage because of cold. You know, we're warm mammals, warm-blooded mammals. We need warmth all the time, and we need to have that in mind in order to have a life of preserving warmth. We as a Westerners, we don't do that. We give too much, and we put cold all the time. So that's a concept in Chinese medicine thinking.
And what about emotions? How can we identify this too little or too much influx of energy, the leakage in emotions?
Yeah, for example, anger can be a leakage. You know, that's why in cultivation we try to like be always rooted with no false heat, no. And once you have an anger, it's the dragon that consumes you. You know, so that's anger is super interesting, but sometimes it's not that you have to go to an anger management therapy. You have to treat the system in the circulatory way. Otherwise, it's not. Even with meditation, that happens with even meditation that they say, no, I'm like super stressed. Go and meditate. Yes, but first you need to give that circulatory part, that harmonize that circulatory way. That's gonna make the system more easily to go and meditate, because sometimes there's too much fire and if you don't treat the body, you can't meditate. And those are the patients that say, no, I can't meditate. Everyone can meditate. Is how the system is.
Yeah.
And the anger is you have to treat the body and then go to an anger management therapy. That's the approach, and that's what we're gonna do in alchemy. That's the anger management is an example, but we're gonna try to work in that way. That's that's leakage. For example, those major depressions, that's cold in the inside, and super interesting because they're gonna give you medicines that are like sedative, and they can enhance a little bit or help the depression, but with time it's gonna chronify, especially if you have that depletion of liver function, for example. Yeah. You're charging the liver tomorrow. You're putting too much in the liver that is not functioning well. It can help the system, but at the end it's gonna chronify the whole thing.
So that's why the individual diagnosis of each patient is so important, to identify where the symptoms are coming from, where the leakage is coming from, and identify how to help them in the best way possible according to how their ecosystem is working at the moment.
Exactly. That's the main thing. Even we have a lot of discussions with Alegria, that is our nutritionist, that we need to evaluate in order to, like, for example, this entity that for us is super important, that is the spleen yang deficiency, that is this cold earth. Mm-hmm. You need warmth, and you can identify that in Chinese medicine. So it's not what you eat, is what you digest. So we are always like having discussions about this, reading the theory, between the two. So the two understand very well. I understand very well her approach, but she understands very well the Chinese approach that is super important. And I always tell Alegria, this is gonna make a difference in your patients. If you treat in the biothermic way, it's gonna be a big difference. So we have these concepts like very clear.
That's amazing, and also to know that during the retreats, the program is going to be tailored to each patient's needs. So, for example, we were talking the other time that if someone is cold, you're not going to give them celery juice in the mornings because it's going to be not good for them. So instead, maybe the warm bone broth or whatever it works for them. So that's the main difference between this retreat, a normal wellness retreat, and this is actually a place where people can come and get treated for their ailments, disease, and symptoms.
Exactly.
That's amazing. I think I think I don't have any more questions for you. I think that's it.
Yeah, but I want to talk about yoga in the mornings.
Okay, we
with
can.
your yoga. It's amazing. We did that like in that 3 day retreat that we had, and actually it was amazing. Your type of yoga, I really like it because is one of the cultivation part you have like really rooted there in your type, that for us in Chinese medicine is super interesting. For example, for me the horse stance or the mabu is that isometric exercise is super important. The yin yoga, I think, relates with that, so for us we're like really connected in that way.
Yes. I really like, okay, so I did train in Hatha yoga and Vinyasa yoga, which is the more dynamic types of physical practice. But then I also trained in other types of movement disciplines in which it's not only yoga. And I understood that there is also a need now also in the Western world to complement our movement with other types of more functional movement, along with the cultivation, with breath, with activation of certain muscles. And I think it is a very complete way of waking up your body and also relaxing your nervous system, which is kind of like the whole point of it. And also, for example, when we were doing the cultivation, breathing, and the horse stand, to be able to incorporate those movements of the arms and also the breathing during the yoga postures, like any asana, it makes the experience a lot more interesting. And you can feel the difference in your body while you're doing it, and also a clear before and after. So I think that's where I want to go with the practice that I'm delivering in the morning.
Yes, I really with that retreat that we did with you, I really felt that we were doing alchemy there. So it was super interesting.
Yeah, I think that's it. I don't know what else I can tell you. So also with I will also be playing some music and sounds to help relax people, not as a part of a therapy, but more of a immersive experience in which people can let go and they can be open to what's happening in the retreat. So, they come, they rest, they feel supported, they feel at ease, and they can let go of themselves, any judgments that they have, and they can be open to the experience, to the transformation that they are going to have with us.
Perfect.
So that's it.
Yeah, there's one of the therapies that Jose Zambrano is doing there, that is Temazcal, that are really, it's super interesting for me because it really helps. It's heat therapy for me in Chinese medicine is a heat strike, but if you are in the moment, if you have a system that you can receive heat, is experience that you can have, because it really helps. So we're gonna have like a lot of different approaches that we're gonna complement there in order to help the people, help the patient.
Yeah, it was amazing. The Temazcal, it's a crazy experience. I felt like I was crying with my whole body. That's how I felt it was, and I left feeling so light. It was just a very nice experience, and I'm really happy that people during the retreats can experience traditional medicines along with conventional medicine and be treated, so they can actually feel that it's legit.
Yes.
It actually helps.
Yeah, and even in the conferences, it was really interesting because we went to the river, for example, because we have a beautiful river there, and we went into, and it was a beautiful, cold relaxation. But actually, I could explain the Chinese medicine theory about the Jingnai and the Jinglu, all the rivers there, in order with the people like feeling it. So I really like that timing there that we had on the rivers, on nature, and it's a beautiful place. So you were invited to come, and thank you, Maria Jose, for being part of the team.
Oh, thank you for all of your knowledge that you've shared today, and also for everything that you are sharing during the retreats. And yeah, that's it. As you know, it's directed to everyone. Thank you for listening, and see you next time.
See you next time. Thank you.